A historical train photograph appears, a timeline with historical photos and dates. 1855 to 1929, orphan trains. 1960s, Spalding for Children.
The story of child welfare in America is dynamic and ever evolving.
1970s, Father Clement starts One Church, One Child.
In the mid-1980s and throughout the 90s, the system was in crisis. Children entered foster care in unprecedented numbers and languished there. We called them the children who wait.
A graph of substitute care and adoption or guardianship subsidy appears and zooms in on the time frame of 1985 to 1998. Both substitute care and adoption or guardianship subsidy data shows an incline. Substitute care at 1985 is about 100,000 and increases to about 200,000 by 1998. Adoption or guardianship subsidy at 1985 is about 25,000 and increases to about 175,000 by 1998.
Professionals, policymakers, and families rallied, and by the turn of the century, things had changed dramatically.
The graph continues to build data for 1998 to 2010. Adoption or guardianship subsidy continues to increase through 2010 and reaches to 450,000, while substitute care begins to decline and reaches 150,000.
In 2002, the number of children in subsidized adoptive and guardianship homes surpassed the number of children in foster care.
Dr. Mark F. Testa, QIC-AG Professional Consortium Chair, Spears Turner Distinguished Professor, School of Social Work, University of North Carolina at Chapel Hill.
I like to characterize this evolution as one from a 20th century foster care system focused on the welfare of children in public custody to now a 21st century post-permanency system focused on the well-being of children in safe and stable family relationships.
This success brought new challenges.
The system became very adept at placing children into families.
Addie Delane Williams, President and CEO, Spalding for Children.
Unfortunately, far too many of these placements either disrupted or dissolved.
Agencies knew these children had complex needs. They did much to prepare and support new adoptive families, but it wasn't always enough.
Families simply were not equipped to handle the challenges that these children brought.
Many of the challenges families encounter can be traced to maltreatment and the impact of trauma.
Trauma, abuse, and/or neglect leading to excessive or prolonged stress to the brain.
Several of our kids were drug exposed in utero.
Elaine Taylor, adoptive parent.
Lead poisoning, crack cocaine, and fetal alcohol syndrome.
Terrell Carr, adoptive parent.
He was malnourished. He was borderline failure to thrive.
Karen and Andrew Beatty, adoptive parents.
The older two kids still vividly remember the police coming and taking them away from their family.
One of my sons was found in an abandoned building.
Beverly Baker, adoptive parent.
The record states that they were starved and tortured.
Allison and Jonathan Douglas, adoptive parents.
The things that have happened to our children are things that shouldn't happen to children at all, and really have changed their development and the way that they think about the world.
Hazeline Pilgrim, Executive Director, Family Support Organization of Essex County, New Jersey.
In the last 20 years, we've learned more about brain development, and one of the things that we know is that there are certain changes in the child's brain when they experience even prenatal or early infant or childhood trauma.
A sample brain scan of a healthy brain appears. The temporal lobe locations are identified near the front of the brain. This area has red regions that indicate high activity. A sample brain scan of an abused brain appears. The same temporal lobe locations are identified and now have dark regions instead of red regions to indicate inactivity in the temporal lobes.
The changes that occur have to be healed. And one way of healing that is through strong relationship and attachment.
We need science to help us discover those interventions that truly work to find permanent homes for children, but we also need science to find those continuing post-permanency services that would preserve those placements.
Introducing the Quality Improvement Center for Adoption and Guardianship Support and Preservation.
Spalding for Children, in partnership with the University of Wisconsin at Milwaukee, the University of North Carolina at Chapel Hill, and the University of Texas at Austin.
Working in partnership with 8 sites, the QIC-AG is developing and evaluating evidence-based models of support and intervention to achieve long-term, stable permanency in adoptive and guardianship homes.
QIC-AG partner sites identified as the states of Texas, Wisconsin, New Jersey, Vermont, Tennessee, and Illinois, Catawba County of North Carolina, and the Winnebago Tribe of Nebraska. Melinda Liss, Project Director, National Quality Improvement Center for Adoption and Guardianship Support and Preservation.
To guide the work of the QIC-AG, we created a permanency continuum framework. The permanency continuum framework has 8 intervals.
Think of the continuum as a way to visualize a family's lifelong adoption or guardianship journey. The intervals represent needs that might crop up for that family along the way.
A flowchart representing the permanency continuum framework. The chart begins with pre-permanence divided into 3 intervals: stage setting, preparation, and focus services. Next is finalization. The chart continues with post-permanence divided into 5 intervals: universal, selective, indicated, intensive services, and maintenance. The 3 intervals of universal, selective, and indicated are further labeled as prevention.
They need preparation prior to the child coming into the home. They need support while the child is in the home, and they continue to need support after the placement has been finalized and through the life cycle of their placement.
With its partner sites, the QIC-AG is testing 8 interventions in 5 intervals along the permanency continuum: focused, universal, selective, indicated, and intensive services. 8 interventions to prepare and support families, each of them measurable, evaluable, and ultimately replicable.
After rigorous evaluation, effective models of support and intervention can be replicated or adapted by child welfare systems across the country. Joseph Crumbly, Child Welfare Trainer and Consultant Member, QIC-AG Professional Consortium.
The field is at the point where we're able to measure what we do. We've actually been able to come up with interventions, which is exciting. You know, when before 20, 30 years ago, we didn't have them, but now we have them. And now we're ready to actually do it in a rigorous, scientific, evidence-based way.
8 interventions to keep families strong and stable.
If you want a healthy family and you want the best possible outcomes, you anticipate where there may be some bumps in the road, and you get tooled up with the information and the resources necessary to be able to navigate those moments of challenge.
Being okay with the fact of saying I need help or I don't know how to. When I need help, I gotta ask for it. I have to go get it. And you have to be willing to accept help even when you don't think you need it, and ask for it when you do.
Even though there have been tremendous strides in moving children out of long-term foster care into permanent homes, that movement doesn't mean that their needs suddenly disappear.
After you adopt, and this is one of my pet peeves, everybody goes away. What part of mental illness went away? The child is still the same child.
Once you sign the paperwork, the history of the child doesn't go away. It's not like I signed the ink and then all of a sudden the slate's clean.
They still are the children that they are, and they may need a lifetime of support. And we as parents need support.
We still need that support. We need it more than ever after adoption, because we're still struggling.
8 interventions for the 21st century. Family-friendly, child-focused, informed by best practice and hard science, driven by what we know about trauma, the brain, and child development.
We think that the work of child welfare ends with permanence. No, actually, that's when it should begin.
A production of the National Quality Improvement Center for Adoption and Guardianship Support and Preservation at Spalding for Children, a service of the Children's Bureau, U.S. Administration for Children and Families. funded through the Department of Health and Human Services, Administration for Children and Families, Children's Bureau, grant number 90CO1122-01-00. The contents of this video do not necessarily reflect the views or policies of the funders, nor does mention of trade names, commercial products, or organizations imply endorsement by the U.S. Department of Health and Human Services. This information is in the public domain.